Hello, I'm Kim Linder, your host of the Caregiver Hour radio show. We have Dr. Michael Cromer, who's the medical director of the Addictions and Recovery Unit here at the Town and Country Hospital. We're going to be talking about some important issues about addictions for people of all ages and how they can get recovery here at the Town and Country Hospital. So welcome, Dr. Cromer.
Thank you.
Why don't you tell us a little about who you are and how you got into the profession of addiction recovery?
Okay. I'm a local family practice doctor in town, but for the last 20 years I've been the medical director here at Town and Country Hospital. Here at Town and Country Addictions Recovery Unit, we see people who are battling all sorts of addiction, especially trying to get off of alcohol and pain pills or opiates. And in any given day we'll have about 12 to 15 people on our unit going through the detox process, as well as working on sort of the steps on allowing them to stay recovered. After their treatment here through detox, we then set up aftercare treatment at various facilities around town that does more in-depth counseling in various areas.
So Dr. Cromer, now that you know that there is this problem in the area, what are some of the situations that do occur and how are you able to help them?
A real common scenario is teenagers or young adults in the ages of 18 to 30 who have developed an opiate addiction in an early phase of their life. Often starting pain pills because it was available with other peers, getting a high from it, and then getting an enjoyment from that high. And it's just amazing the number of people we have here in the Bay Area who are in that age range who are battling opiate addiction. Right now we have about 10 people in that age range, and what we typically see are people who have dropped out of school, not furthered their career, still living at home, and is quite a challenge for the caretaker, whether that be a mother or a father or both, or sometimes even a grandparent, who have their own health issues. They're now having to support this drug-dependent young adult. So,
Dr. Cromer, you had mentioned about this age range of 18 to 30 and the people that are taking care of them. You call them caretakers. They're also caregivers, and I was just wondering, how do they handle the strain of taking care of their child or grandchild as well as themselves? What happens in that scenario?
It's a very common situation, Kim. Typically, the nature of addiction is that people are in denial as far as whether they need help or not. Plus, in an effort to support their habit, a lot of these young adults actually do illegal methods to try to get their drugs, whether that be stealing money or dealing drugs themselves. And for the first time in these lives, these caregivers of these young adults are in a scenario that they don't know how to handle. They don't know if they should put their child out on the street.
Right.
They don't know how much leeway and trust to give them, because it's hard to get truth out of people who are battling addictions. A lot of caretakers also are battling their own health issues.
Right.
These are people getting up into their 50s, 60s, and even 70s, and often don't have the physical stamina to be able to battle these younger people and the emotional battles that typically go on in the homes with people with addictions.
That makes a lot of sense, and I could see what how the strain would be. And also for them to all of a sudden realize that they're caregivers. You know, they think of themselves as parents, but now we're looking at them also as caregivers. What about the person who is a senior, who is also an addict? Is that a common scenario also here in the Tampa Bay area?
Yeah, that's another scenario that we see. Often people who have been closet alcoholics or functional people who have somehow got addicted to pain pills due to various reasons. But we often take care of them here on this unit when things have reached a crisis at home. They have become dysfunctional. They have become disattached emotionally. They have become angry at their spouse, and or angry at their child. And that is another very common thing of taking care of the 60-plus adults who now usually has physical ailments in addition to their addiction.
Wow.
And that's why taking care of them here and getting them detox in a hospital-based setting is often a safer thing for them to do.
So what I'm hearing is that you take care of the addiction part, but also you take care of the medical part.
Correct.
Okay, and that's really a perfect scenario here at the Town and Country Hospital.
Right, and one other thing we also do is that every Thursday night is family night. These caretakers who are raising up these kids or taking care of these kids, or children who are taking care of their parents who have addictions, On Thursday nights, we offer classes here to know how to better cope and to be the appropriate caretaker in this scenario.
Dr. Cromer, you've given us some very important information. What if someone wants to get in touch with you that has that situation going on in their life right now? How would they contact you here at the hospital?
If you're interested in finding more information about helping one of your loved ones for detox from alcohol or opiates, you can reach us by calling 813-884-1904. 813-884-1904. And someone will be standing by and gladly to answer your questions.
So is that 24/7?
Yes, 24 hours a day.
Okay, so that's a hotline for people.
It's someone working here
at the hospital.
The local staff.
And do they do intakes then as well, 24/7?
We even do intakes and over-the-phone assessments 24 hours a day.
Okay, that's excellent. Well, Dr. Cromer, you're going to be on our show this Monday, February 28th from 11 a.m. to 12 noon Eastern Standard Time on 1250 AM WHNZ.